Well, school has been in session now for several weeks, and as we get closer to the start of respiratory virus season, the Rochester region is already starting to see a higher number of cases of COVID and whooping cough in kids.
Natalie Kuchko is here now with some advice from a local doctor. Natalie.
Yeah, so over the summer, we did start to see a rise in COVID cases in kids, especially as we've officially entered the start of the fall season now. And with those kids back in the classroom, we are told those case levels have relatively stayed the same.
We've definitely been seeing a lot of COVID in the community, really, since numbers were down in the spring, have kind of increased over the summer, and then have kind of stayed at a higher level. Of course, it's still less than what we saw kind of at the peak of the Omicron surge, but it remains very elevated.
As school's in session, so too is the presence of germs. Dr. Jennifer Nyack with WROC says as COVID cases remain high, whooping cough in kids is going around as well.
Make sure your child's up to date on vaccinations. Infants are able to be protected by nirsevimab or maternal vaccination. We don't have a vaccine for RSV for older children, but you can protect your infants. Infants are the population most at risk for severe disease and hospitalization. Really, it's just try to prevent what you can in terms of getting vaccines. And then the other thing would be, to remind parents that kids are in close contact, depending on the age. They might not be able to, they're sharing germs more than frequently, especially at younger ages in daycare and even in high school.
With RSV levels typically beginning in October and influenza to follow, doctors say staying vaccinated is key.
Just a reminder not to send your children to school when they're sick. So if they're having obvious symptoms of an illness, keep them home from school.
As always, hospital leaders do recommend you check in with your primary care provider first to make sure your family is up to date with vaccines. October's going to be here before we know it. Back to you at the desk.